and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. And so with that, we'd like to formally bring on our guest today, Sydney Cooper, who is a senior UX designer. Thanks so much for joining us, Sydney.
Thanks for having me. I'm excited.
Absolutely. Same with me. I think it's going to be a really fun discussion and would love if maybe we can kind of kick things off by just, having you tell a little bit more about yourself, your background, and what really inspired you to kind of pursue a career that is, this nice blend between creative and innovative within like the healthcare landscape.
Yeah, so my formal background is in public health. I also have a background in user experience, both design and research. But essentially, I wanted to be a change agent in the healthcare industry. And I recognized that if I was really going to make a difference, then I was going to have to get creative. I really
Mm-hmm.
wanted to take a career path within the healthcare industry that would actually take consumer and customer feedback to innovate.
Love that.
But in college, like most of us, I thought I wanted to be a doctor. And I took one chemistry class and was like, no, like, this is not my calling. We all need to know what our strengths are. And I realized very quickly that chemistry is not my strength. And I was successfully weeded out. So it did its job. But years later, when I was in grad school, I had to take a practicum, and I did mine with Blue Shield of Massachusetts doing corporate strategy. During the practicum, we actually had a human-centered design week. And at the time, I thought it was just a cool like intern team building that also tested our creative thinking. I had no idea that it was a full career path. We essentially spent the week brainstorming a healthcare product for, I think it was union construction workers, if I'm remembering correctly. But that week involved whiteboarding, wireframing, prototyping, guerrilla style research, and then iterating on our prototypes, which was really cool. And it was probably the most fun that I had all summer. Loved the work. So, like, thank you, Blue Shield, for having me as a corporate strategy intern. But that's like one week that really stuck out in my mind at the time. So basically, we did everything that would be involved in a UX or CX or human centered design sprint.
Mm.
And I was like, man, it would be really cool if I could do this. Like, maybe I just need to, like, I don't know, work with interns for the rest of my life. But I knew I wanted to stay in healthcare.
Mm-hmm.
So after grad school, I ended up sticking to corporate strategy because I realized I was good enough at it. But I also started to see that it didn't really feed my soul and my internal mission because I
Mm.
didn't always know why we were implementing the things that we were implementing.
Right.
And then even when I would ask, it would be focused on like corporate profits, which don't get me wrong, it's important for the company and somebody needs to focus on it. But I knew that wasn't going to be my path.
Mm-hmm.
So from there, I just kind of like fell into UX. I think I got COVID one winter and I have trouble sitting down and doing nothing. So I decided to take a UX boot camp. And then I was like, wait, this is exactly what I did a few summers ago. This is my new career path. And that's kind of how I fell into UX. And then on the side, I was already doing blogging and working with Health in Her Hue, which I'm sure we'll get more into. But that's kind of my story on how I landed in such a creative field.
That is incredible. And I love how it kind of was like a full circle moment where you kind of are now working in something that inspired you like those years ago.
Yeah, for
That's
sure.
incredible. And I'm also so curious, I think because you have, worked in UX when you were in grad school, that you're doing it right now. And I can imagine as, we are increasingly becoming more and more digital, the role of UX will continue to shift. Would love if you could shed a little bit of light of, how you see the role of UX specifically in healthcare evolving over time.
Yeah, I love this question because I feel like UX is newer to healthcare if we think
Mm,
about it holistically. Uh,
totally.
so, on a broader level, I see the UX and CX discipline being integrated into healthcare more as healthcare modernizes. From
Mhm.
my perspective, traditional healthcare focuses a lot on medical outcomes as it relates directly to patient care, which is great.
Mhm.
But as healthcare evolves, and especially after the pandemic, I think we're beginning to see an increase in consumer health tech. And that will eventually impact healthcare outcomes outside of just being in the traditional healthcare system and the
Mhm.
everyday lives of patients. So, with that being said, user experience focuses on usability, accessibility, and access in a way that is affordable. And I think that it's going to become increasingly important to assess those things.
Mhm.
And especially when we're developing new products that we haven't seen before, or if we're bringing in products that exist in other industries and try and use it for patient outcomes. And then, more specifically, the hot topic that everyone likes to talk about, which is the use of AI and
Yeah.
how it's coming to healthcare and healthcare's consumers. So, basically, everyone.
Mhm.
With it being a newer technology that requires a lot more user testing to assess and improve on the usability, accessibility, and equity, we really need to better understand how providers can benefit from AI, what their
Mhm.
motivations, fears, and blockers are going to be when it comes to AI specifically. And I was actually reading an article in Politico a few days ago, and I think it mentioned something along the lines that like some AI developers are getting really nervous about the use of AI by doctors because sometimes when users get the product, they start to just kind of blindly trust it. And
Oh,
yeah, so it's like,
interesting.
I think from one perspective, it's understandable that doctors are going to start to blindly trust AI because it's right about a lot of things.
Mhm.
Doctors are really busy. And when they can get their hands on a tool that will make things easier for them, when we know they have like a million things that they're worried about on the day to day. I can totally understand why a doctor might start to rely a little too heavily on AI.
Mhm.
But I think um, we know that the information that AI is being trained on comes from information that might be systemically racist or biased that could negatively impact patient outcomes. So I think there still needs to be a critical thinking component. And that's
Mhm.
something that UX needs to consider when we're starting to help these organizations implement AI technologies.
Absolutely. That's
And
incredible.
yeah, so that's just like one perspective of it, because on the other end, we need to assess how patients feel about being on the receiving end of
That
AI.
is very true. 100%.
Yeah, because I think, I mean, even when it first came out, like I think people were trying to like break the system or like test it,
Mhm.
which is cool when you're talking about social media and traditional forms of tech. But when it comes to healthcare, I think it's going to be really important to try and break these technologies
100%.
because what they're being used for, it truly is life or death. And especially patients of color, which is a group of patients that I'm very passionate about. They're already experiencing challenges in the traditional healthcare system, and they could now face even more through AI or AI that's trained off of those traditional healthcare data sources. So even though AI might make things more convenient, it might make things faster. Is it going to make it safer? And efficiency is effective, or is it effective and does it make things faster? We see the fast part. Now we need to start looking at like the safety portion.
Quality, totally.
Yeah, yeah.
100%. No, I really love that you kind of touched on the AI component because I think the way that you talk about the relationship of UX and how it really is about thinking about the broader picture when it comes to how we as human beings are interacting with the world around us. And a lot of that is technology itself. I think makes a lot of sense. And I also really liked that you are talking about the role of UX, especially when we think about the consumerization of healthcare. And it just made me think about how a lot of consumer tech platforms like Amazon, like Apple, all of these other companies are really focusing on healthcare, and they have the history of UX. They've spent a lot of time investing in it. So it's definitely something that a lot of incumbent healthcare systems need to do too.
Yeah, for sure. And I think I personally would like to start seeing these traditional tech companies that have the infrastructure and the technology in place partner with some of these larger healthcare organizations, because then you get the best of both worlds. You have the people that already have all of those systems in place to test and then iterate, but you also have people with that understanding of the healthcare industry, because I think we see a lot of these big disruptors try and come into the industry thinking that they can solve healthcare. And I love the ambition, I love the energy, but those of us that have been in healthcare long enough know how complex it is and know that there is just so much that is not like, it doesn't function the way a traditional or a different type of industry might function. So I would really like to see that synergy.
That's great. That'd be a dream partnership. I support that 100%.
Yeah.
I love it. I also kind of wanted to ask you, I know that you did a lot of work kind of specializing in specifically like communication storytelling. Would love if you could share a bit more on kind of that work, but also really what you see the impact is when you spend the time to focus on the storytelling component.
For sure. So, when I was in grad school, I started learning a lot about how to navigate the healthcare system as a public health professional, which is awesome. But my degree was really expensive, and the people that are using the healthcare system don't necessarily have access to this information. So I decided to start a healthcare blog, and selfishly, it also helped me learn like what I needed to learn to pass exams and stuff. But I also wanted to simplify complex healthcare topics for everyday consumers to kind of close that knowledge gap.
Mm-hmm.
And after I started doing that for a while, I started to build a bit of a community of both healthcare professionals and consumers or patients, just talking about how much having simplified information, even to the point where I was using GIFs and memes to just like share, you know what I mean? Just make it a little bit less intimidating to find the information that you need. Because at some point, we are all going to have to be part of the healthcare system, whether we like it or not. You can't avoid it. And even being in healthcare and working for health insurance, it's interesting because my first year off of my parents' health insurance, like I struggled to pick a plan when I worked there. Like I had no idea what I was supposed to be selecting.
That is such like a universal experience that I think all of us have faced on some level. That's incredible.
Yeah, because it's just like, and this is, I have a master's in public health, and I'm like, okay, HMO, like I'm literally Googling these things, trying to figure out what plan makes the most sense for me. And that's also the thing about healthcare. It's not a one size fit all solution. So that's why you really have to simplify all of the information so that people can make informed decisions that make sense for them and their experiences. So yeah, that's like kind of why I started my healthcare blog, Your Healthcare Scoop. And while I was blogging, I happened to connect with an alumni of my undergrad, which is Howard University. And she's now the CEO of Health in Her Hue. And it's an organization that basically connects women of color, really anyone of color, but particularly women of color, to culturally sensitive healthcare and healthcare providers. And I was like, whoa, like, and again, this was in grad school. So I was like, wait, that's like really cool. I would love to do that full time. So I just kind of reached out to her and was like, is there anything I can do to support you? I'm still in grad school. So like, you know, can't quit school and come work full time, but I would just love to support. And that's how I got involved with their community conversations, which ended up taking my experience with storytelling and sharing consumer experiences to a whole nother level. Yeah, so now I get to work with them on a regular basis where I get to talk to healthcare providers and ask them questions about specific healthcare topics. But in that, what's really cool is we have a live chat feature very similar to this one during every webinar where people, everyday people, can share their experiences and kind of connect with doctors. So not only are patients learning healthcare information, but these providers are also learning about the patient experience on the other end. So it's like a really nice exchange of experiences and information that I think over time will continue to improve people's experience within the healthcare industry, but also provider like not only expectations, but their perceptions of the care that they're providing.
I love, yeah, it really is like a two-way street, which I think is incredible that you've been able to build it. And yeah, tell us more about Health in Her Hue. That sounds so needed, and really, really fascinating. Would love if you could share a little bit more about the work that you do, a little bit more about like the platform and the impact that you're hoping to have, by contributing.
Yeah, so definitely don't want to speak on Ashley's behalf, but just like a little plug for them because I feel like very aligned with the work that they do. But Health in Her Hue is really just an organization that's really passionate about making sure that people have access to resources and information to navigate the healthcare industry. One thing that I really, really love is when I talk to these providers, they're kind of normalizing like patient self advocacy, and not that it's like and just so that our viewers kind of understand patient self advocacy, it's just when a patient kind of does some of the groundwork to advocate for themselves, not blindly trusting a provider or the healthcare system, because historically a lot of patients of color haven't been able to, or when they have, it hasn't ended well.
Mm-hmm.
So Health in Her Hue, in part, just one part of what they do is equipping people with this information and connections to culturally sensitive providers. But these providers, I love when they talk about finding a provider that you feel aligned with and comfortable with, and how that impacts patient outcomes. And
I can only imagine.
yeah, it's like, because if you think about it, if you have maybe it could be the best doctor in the country, number one ranked. If you
Mm-hmm.
don't feel comfortable with this provider, you're not going to be completely honest and transparent with this doctor about your lived experiences, or you might show up in a way that's not fully authentic. And when it comes to healthcare, you have to be authentic in order to get the help that you need. So just finding a provider, it doesn't even have to be a provider that looks like you, but a provider that can acknowledge the things that you've gone through, really listens to you, or if they can't support you, can make recommendations for providers that do. Um, so kind of like putting like that, again, human-centered approach
Mm-hmm.
into healthcare. So yeah, that's just part of what I do. I'm on the community events moderation side, and then kind of I'm starting to help them with more content to like bring awareness to the platform. But yeah, that's my role. If you want to learn more about them, literally just Google Health in Her Hue or go to healthinherhue.com. They're awesome. So yeah.
That is incredible. And I love that you, I mean, are kind of speaking to the need for comfort, because I feel like your relationship with your physician is a relationship and you want to be comfortable in relationships. So I think that makes a lot of sense. And I'm so curious, since I know that you spend a lot of time moderating and doing a lot of work kind of on the community side, are there any kind of pressing healthcare issues or topics that have really been rising to the front? I'm just so curious from your work with Health in Her Hue, but also your work kind of as a UX designer. Are there any kind of key, topics that are really percolating right now?
Yeah, so it's really hard to pick just one because I'm not going to go on a tangent, I swear. But in my opinion, the most pressing issue and the issue that keeps coming up is related to access and cost.
Mm,
So there are a lot of different reasons that healthcare in our country is inaccessible or expensive. But one thing that I keep seeing is inefficient billing processes within provider offices.
mhm.
And also not just provider offices, but insurance companies as well. And I can say that because I have worked at one long enough to see it and to see efforts put forth to improve those processes.
Mhm.
But I'm really hoping that people start to find creative solutions, and AI could be a solution because it might, I think before it gets to the patient, it probably needs to start on the back end because it's easier to break that and for that not to work,
Yeah,
and iterate
definitely.
upon before it actually gets to patients.
Mhm.
But realistically, looking at creative solutions instead of like political ones, since our healthcare system and the payment model is so political,
Mhm.
I think would be really, really helpful. But yeah, I think the most effort should be put towards things like billing and inefficient processes. Healthcare is kind of like that last industry where consumers are receiving services with little to no information prior about
Yeah.
cost, which sucks because it's like you need it. Like you can't say like I can't afford this. I mean, you could, but it's going to have terrible health outcomes.
Right.
So I think it would be really cool if you could like check into an appointment and get an estimate, or if you could like finish up your appointment and get like an estimate for how much you would be responsible for.
Mhm.
Yeah, just kind of again moving more towards like a consumer model, but still
One
keeping like that human aspect.
I love that. If we have that, that would make me so happy. I think that transparency is so needed, especially when you think about how much the burden and the onus is always placed on the patient to then reconcile those charges, have to, go through the entire process to get either the quote or all of that. So that is the dream. I think that can happen. I'm very optimistic about that.
Yeah, instead of waiting like weeks and then getting a bill, realizing whatever you got wasn't covered, it's too late by then. So it's
Totally.
like, yeah, so that would be awesome.
I love that. And kind of speaking of the future and really a lot of the work that you're doing, would love if you could share a little bit more about just the various projects or initiatives that you're currently working on or are planning. Just would love to pick your brain a little bit about that.
Yeah, so a little bit, it's somewhat related to like the big issue of cost and access.
Mhm.
But I actually recently left California for personal reasons. So I'm no longer with Blue Shield of California, which sucks because I loved it there and like literally had the best manager ever. But in the interim, before I start my next corporate job, I'm actually in the very early stages of working on a digital holistic wellness company. And
Wow.
yeah, so I'm very excited about it. It's called 111 Wellness. And really the goal is to support people on their wellness journey. I think as medicine advances and then negatively as environmental conditions worsen, we're seeing more people live longer with chronic illnesses. And those
Mm,
can be things like hypertension and depression, for
right.
example. But I've found that chronic illnesses can actually be mitigated or prevented through holistic wellness practices that you can integrate into your everyday routine. And that kind of touches on some of that like access and cost issue, but also like the awareness and the storytelling. But essentially, I'm working on a digital platform or a digital solution that kind of connects people to some of those holistic wellness practices that they can incorporate into their everyday. So, yeah.
I love that. Just infusing wellness one bit at a time. Very, very needed.
Yes. Yeah.
That's incredible. Also, kind of wanted to ask you, touching on kind of the UX side of the house, for maybe folks that are listening that are kind of interested in, pursuing a more quote unquote creative, component to healthcare. Is there any words of advice that you have? Anything that kind of comes to mind that really helped you when you were kind of carving out this piece to influence?
Yeah. So I would say definitely pay attention to the work that you're doing and kind of the things that make you excited, because those are the
Mm,
things that are speaking to your internal mission. I think actually during one of my internships, we did an activity where we looked at the things you're good at, the things you're passionate about, the things that you're bad at, and the things that you dislike. And you just like do, I think it's like a 4 quadrant square or something, and you fill out that piece of paper and you kind of just look at the things that are in each of those boxes and you try and align on or find a career that kind of
mhm.
speaks to that. There are a lot of creative opportunities within healthcare, and you don't necessarily have to be a provider to make a difference. And I kind of wish that someone had told me that early on. But yeah, just literally connect with people that are in career paths that you might be interested in. Ask them questions. A lot of us are very, very candid, especially working in healthcare. Like we want people that are going to be passionate. Feel free to reach out to me, ask me any question. I am very, very candid. Anyone who has reached out to me finds that out very quickly. Yeah, I would say just like connect with people that are in career paths that you might be interested in. Don't ever be afraid to intern or contract to try something out. And
Mm.
also don't ever, ever, ever be afraid to pivot. I have pivoted so many times to like get to where I am. Yeah, you can literally have like years of a career and decide that you want to do something else to make a difference. But the experience that you got from that previous one might be building you for your next career path. So,
I love that. That's incredible. And we will definitely post the link to Sydney's LinkedIn for anyone that is interested in picking her brain about UX or really anything. I mean, you've been such an amazing just wealth of information. It's been so incredible. And also kind of wanted to ask as well, I think, being in the UX kind of community, but also in the broader healthcare innovation community, of course, it's very important to like stay on top of trends, kind of understand what's happening in the broader landscape. Kind of how are you staying updated? What are there any particular resources that you like? And are there any emerging technologies or trends that excite you too?
yeah. So the first one is healthcare conferences. I just got back from Tech Week in New York, which was awesome. Like, I'm literally meeting founders, creating solutions that I never even would have thought of just by
That's
having a conversation. So, yeah, in person or virtual networking events are how I kind of stay up to date on what's going on. A little bit more controversially, TikTok. I'm like a huge TikTok user. So yeah, it's obviously be careful who you follow, but like, yeah,
yes.
there's a wealth of information there. And then some of the traditional like healthcare articles or like news sources. So
That's awesome. That's incredible. And then are there any part, I know we kind of touched on AI a little bit, but I think I'm just so curious because you in your work as UX have also done a lot of research and are talking to patients themselves. Are there any particular trends that you're seeing or even consumer behaviors that that's kind of exciting to you or something that's interesting that speaks to like the changing healthcare landscape?
yeah, so I don't know about AI. Obviously, there's Chat GPT and companies are starting to integrate things like that. I think we do kind of have to be careful about the patient facing chat GPT because it
Mm.
reminds me of WebMD a little bit. Like, if you type in certain symptoms, like it might say
Yeah,
that
it's
you are
fine or it's something horrible.
like
There's no
really
in
not
between.
fine. Yeah. Yeah. But I mean, I've also seen articles where they're literally like sensing cancer
Oh,
from
wow.
just people inputting symptoms in chat GPT or OpenAI type
Wow.
platforms. Again, when I went to Tech Week, a lot of the solutions are on the back end or it's like working on the healthcare system. One
Mm-hmm.
thing that I think will be really cool, especially as populations age, is elder care and like hospice care. I think that that's going to be really big moving forward. We are living longer, but we are not immortal. So it's like,
Mm-hmm.
I think that's where a large amount of our population is about to be. And a lot or a large percentage of the population is entering that Medicare phase of their life. So, yeah, I don't know if I've seen anything that I think actually I went to one talk. The company is called Guaranteed. They're doing some really cool space or really cool work in the health tech space. So I would check them out. But yeah, just talking about like that end of life or older age care.
Yeah.
They're doing
That's a good observation. I definitely think that's going to be really, really huge in the coming years for
yeah,
sure.
yeah.
I love that. Well, I just realized that we are at time, which is crazy to me. I feel like that just flew by. Thank you so much, Sydney, for taking the time to chat with us. I think it's been such an inspiring conversation. I really appreciate you just, sharing all of your words of wisdom.
Thanks for having me.